as a parent, take care of yourself too. Putting on the oxygen mask is not just a trite phrase. It means take a deep breath, know you're doing the best you can today and every day. And if you mess up, apologize to yourself, to your child, to your spouse, to anybody you want to, and make the next step. And we all mess up, and it is a long road, but you can do it. Your child can get better, and we're here for you, one way or the other.
Hi, and welcome to the LymeBytes podcast, where we shine a light on the misunderstood science of Lyme and other vector borne diseases, as well as the truths that many still miss. I'm Dr. Mariah Hinchy, naturopathic physician and fellow of the Medical Academy of Pediatric Special Needs. I specialize in treating chronic Lyme disease as well as other complex inflammatory conditions. In this podcast, we break down what's working and what's not. We share the facts that most people miss, we challenge outdated thinking, and we give both patients and practitioners the tools to heal smarter. So let's get into it and change the way we heal Lyme.
Today on LymeBytes, we're honored to welcome Dr. Nancy O'Hara, renowned pediatrician, fellow of the Medical Academy of Pediatric Special Needs, and a true pioneer in functional and integrative approaches to complex childhood illness. She's not only a leader in the field, she's also my personal mentor and someone whose work has transformed the way I and we care for our most vulnerable children. In this episode, Dr. O'Hara dives deep into two of the most misunderstood and misdiagnosed pediatric conditions, POTS and PANS. We're going to explore their root causes, the immune inflammatory connection, and what real recovery can look like. Get ready to challenge old models, embrace new science, and uncover real hope for healing. This is LymeBytes, bringing truth to light and healing within reach. Let's dive in. Thank you so much, Dr. O'Hara, for being here. Tell the audience a little bit how you got into treating pediatrics, pediatric Lyme, autism, PANS, PANDAS.
Oh, that'll take the whole hour. But thank you, Dr. Hinchy, Mariah, for inviting me. I'm very passionate about this subject, and I started my career as a teacher of children with autism, and truth be told, I was a lousy teacher, and I mean that sincerely, and I took the easier route and went to medical school and thought I was going to do psychiatry, then realized I had to take care of adults, and I really don't like adults very much, as many of you already know, and instead went into pediatrics, and I was a pediatrician, had a lot of children with autism within my practice, and one of my patients, a 4.5-year-old, non-speaking child with severe asthma and allergies, changed their diet for, a diarrheal illness. Took out dairy, took out gluten, and started speaking. And she called me, and I thought it was hogwash. Now, this was, over 30 years ago, and she said, just go see this guy. And that guy was Dr. Sidney Baker, who is the grandfather of functional medicine. And I was going through 4 years of infertility at the time and went to him as a patient. And it changed my life. I have a beautiful 26-year-old son who then, 9 years later, devolved into seizure-like tics after a strep infection, a Lyme Borrelia positive tick. And I missed Bartonella at that time. Even though he got better, everything resolved, I missed Bartonella. So fast forward 7 years later, now finding Bartonella, which had probably been there all along, then mold, then COVID, then Babesia. So, and there's the POTS and dysautonomia on there too. So I live it personally. Although all of you listening to this podcast, don't talk to my son because I raised him to believe that it was his own sheer will and determination that was pulling him up from his bootstraps, which has helped with a lot of girlfriends and professors and other things that may not be as helpful to him as they possibly could be. But, this disease is treatable. And I have learned so much over the last 25, 30 years on how we can treat it. And what we first have to do is be aware of it and look at it.
Right.
look for it.
And I think a lot of the best practitioners out there are the ones that have had to either recover themselves or recover their child or someone who they're very, very close to, because you learn it from such a different angle.
Yeah,
Right. And you just understand so much more about it and the nuances and the everyday. And so it makes you so much better able to troubleshoot all of the various things that our patients struggle with as well.
absolutely. As well as our parents, because
Right.
as a pediatrician, for me, it's always about the family unit. And as somebody that's been through it, I also recognize the PTSD that this disease can bring to families. And it's important for moms and dads to recognize that, especially when we talk about the POTS and dysautonomia part, because that really also impacts them.
Yeah.
So
And for our listeners who are wondering, okay, this is primarily a Lyme disease podcast. Why are we talking about PANS and why are we talking about POTS? And as I'm sure most of you listening know, Lyme and other vector borne diseases can often be the root cause for PANS, PANDAS, and POTS. So, for those of our listeners who are new to this diagnosis, Nancy, let's start with some basic explanation of these various diagnoses.
yeah. So PANDAS is pediatric autoimmune neuropsychiatric disorder associated with strep. So by definition, it has to be only a strep infection that leads to that. Um, PANS was developed by a group of 30 clinicians, researchers, led by Sue Sweeto in 2012 to make the disease more understandable, less controversial. That certainly didn't happen, but PANS was pediatric abrupt onset neuropsychiatric syndrome. So included Lyme at the time. It's on the white paper from 2012. And Lyme is Borrelia burgdorferi, but we often think about all the other co-infections. And I think both of us agree that we really should be talking about tick-borne diseases or vector-borne diseases because there's so much else than just Borrelia. But back to PANS, it really was trying to encompass these other infectious causes of these neuropsychiatric symptoms. So those neuropsychiatric symptoms are OCD, a restrictive eating disorder, anxiety, tics, handwriting deterioration, behavioral regression, uh, attention and other school performance deterioration, and somatic symptoms like abrupt onset of bedwetting or sleep disturbances. And, we both are now in the podcast world, and I recently interviewed Sue Sweeto on my podcast. And in deference to her, I want to say two things about those before I go on to POTS. One, the P is pediatric. Nobody disagrees that this can happen in teens, young adults, and even adults, especially the tick-borne diseases and mold, which should also be in this differential. Or if children were underdiagnosed, misdiagnosed, mistreated, undertreated, that lack of appropriate assessment and treatment in childhood can um, it, make a person have those diseases later in life. So you certainly could have them then. And then the second is that strictly it needs to be abrupt onset with PANS or PANDAS. However, we all know if the abrupt onset was very early in life, the second or third can be much more subacute. And certainly with tick-borne diseases, Borrelia, Bartonella, Babesia, and with mold mycotoxin diseases, it can be much more subacute or chronic. And the push is only to call those autoimmune encephalitis of the basal ganglia as opposed to PANS or PANDAS. So it's all the same thing and it's a bunch of semantics, but I think if we really want to help these diseases to be better understood, we should appropriately define them. And then POTS is postural orthostatic tachycardia syndrome. That's sort of like when you stand up and your heart rate rises or you feel like you're going to faint, but it's so much more than that. It's all of dysautonomia, dysregulation of the autonomic or automatic nervous system. So, temperature control issues. You feel hot when everybody else is cold. You feel cold when everybody else is hot. Sweating, uh, um, other nausea, brain fog. All of those can be POTS or dysautonomia. And what we know is that POTS and autoimmune disease are hand in hand in at least 50% of the cases. And so we see, especially when it's chronic tick-borne disease, when it's mold, we see a lot of dysautonomia in these kids. So certainly for those of us who have long waiting lists like you and I, by the time they get to us, there often is this dysautonomia.
Are you ready to revolutionize your approach to diagnosing and healing complex chronic inflammatory illnesses in both adults and children? The LymeBytes Symposium is your gateway to cutting-edge education, groundbreaking research, and innovative therapeutic solutions. Join us at the 2025 LymeBytes Symposium, November 14th and 15th at the Fort Lauderdale Marriott, Pompano Beach Resort and Spa. LymeBytes is the premier functional medicine conference on complex chronic infection-driven inflammatory illnesses. This year's meeting is jam-packed with leading industry experts discussing long COVID, mycotoxin illness, PANS-PANDAS, as well as Lyme and other vector-borne diseases. This conference will arm you with the knowledge, clinical pearls, and practical solutions that you can implement immediately into your practice Monday morning that will literally change your patients' lives and get them on their path to true healing. So join us at Pompano Beach or virtually from anywhere. Register now at lymebytes.com. That's LymeBytes.com.
Yeah. So, why do you think we're seeing such a rise in these conditions among children and teens?
I think COVID has a big part of it. For many reasons. I think COVID as a disease, and in the way we initially tried to treat it with the injections, that we actually may have triggered or reactivated dormant tick-borne diseases, particularly Bartonella and Babesia. And in we know that those diseases often wax and wane. You know, they cycle in and out of the deep tissue, the parasites, the biofilm. And so COVID sort of brought those more to the surface. The same with chronic viruses, EBV, CMV, some herpes viruses, others. Those were reactivated by COVID. Also, because of the lockdowns, there was dysregulation of our immune systems, and our immune systems were not ready to handle then when we re-entered the world. So the young children were not getting the development of immune tolerance that they should have during those years we were on lockdown, or that much of the world was on lockdown. And
Right.
then
And for a lot of kids, that was like, maybe their whole life or at
right,
least half of their life. Because
right,
really, I mean, even though the lockdown was, technically what, like 6 months, I mean, really, it was more like 2 to 3 years, especially with all of the incessant mask wearing
exactly.
and everyone using a disgusting amount of hand sanitizer, and all of the things that negatively affect our immune system and our microbiome.
Exactly, and we all know that we need a plethora of dirt, of
Right?
germs to feed those hundreds of trillions of microbes, flora in our gut, and we were missing that. I
Yeah.
think the second thing is we live in more and more of a toxic world. And our children that get this disease or autism are our canaries. You know,
Yeah.
I grew up in West Virginia. We send canaries into the coal mines. If the canaries die, it meant the mine was too toxic. These children are, and children with autism and all of our canaries, they're genetically more susceptible because there is a genetic predisposition. So they're more susceptible to all the toxins that are in our foods, in our environment, in things that we're giving to our children that we don't even know. And
Right.
so these things break down the barrier in the gut, so lead to a leaky gut permeability, but also the blood-brain barrier and lead to more of these neuropsychiatric symptoms. And then the POTS part and the dysautonomia, that's all very related to the vagal nerve, which is related to the gut, and to the adrenals, which is related to the vagus nerve, which is related to all the stress. So it's all interconnected. And that's why we're seeing all this, in my opinion.
Yeah, no, it really is. And I think that a lot of people, even medical practitioners, don't it's like we know theoretically, but like we don't make the connection between the microbiome and the immune system and inflammation and the immune system and toxins and the immune system and really, or even our diet and the immune system. But in the end, our immune system is literally affected and imbalanced by everything in our every other organ in our body, everything in our environment. And, I always kind of say, like, when it comes to treating any of these conditions or illnesses, if we forget about restoring proper immune function, we're never really going to get anywhere.
Yeah. Yeah, exactly. And we're all of these children are our canaries, are our windows into what all of us are facing. And we need to help our guts through diet, through decreasing the stressors, whatever they are, and through good nutraceuticals, and as you and I believe, herbals and botanicals, to treat all of this. And it can be treated naturally. We don't need to put tons of antibiotics in our kids for months and months on end that are destroying their guts while we're only killing the germs that may be causing these problems. We need to do a more complete and healthful roadmap.
Right.
As my friend Dr. Hinchy always shows us, to treating these tick-borne diseases. So
Yeah.
anyway.
It's funny in the beginning, even when I, learned about Lyme and other vector borne diseases and whatnot, like I literally was like, kill the infection. We have to kill the infection. Of course, I always wanted to do it with herbs, not with pharmaceuticals. But it's really I've started to come around to the idea that like these persistent infections are actually a symptom. They're a
Yeah.
symptom of the underlying immune imbalance. And again, it's like we have to focus on fixing that immune imbalance by doing all of the things. And then the infection becomes so much easier to treat.
Absolutely.
So that was like my
Absolutely.
huge aha moment. But okay, so we've talked a lot about the immune system and immune dysregulation being at the core of these conditions. Can you walk us through like the immune inflammatory mechanisms that you see driving PANS? And then when you're done with that, POTS?
So, the immune mechanisms that happen are first, there's a dysregulated immune response. So, let's think about strep, for example. You get a strep throat infection, or you get exposed to somebody with strep throat. Rather than the antibodies or the proteins within our immune system attacking the strep in the throat, they instead, in susceptible kids, cross the blood brain barrier, the broken down cribriform plate by all the toxins in our world and by all the infections in our sinuses, etc., cross the blood-brain barrier and attack the basal ganglia, that part of the brain that's important for tics, anxiety, OCD, and speech. There can be speech disfluency, so many different things. And that immune system attack in the brain causes inflammation in that area of the brain, and then that causes the symptoms. The reasons for that are multiple. One, genomic or SNP, single nucleotide polymorphisms, like to tumor necrosis factor alpha, to Th17, to many cytokines, interleukins, etc. So there's a genetic susceptibility. And then in addition to that, in those genetically susceptible kids, those cells are different. There's differences in the Th17 cells. For example, there's increased cytokines, for example, and that does several things. One, It increases your gut inflammation, so that decreases your ability to effectively absorb nutrients, etc. And it increases your brain inflammation. And then when that happens, particularly like with the leaky gut, you'll get symptoms, some of which are called POTS, like nausea, abdominal cramping, things like that. But the autoimmune disease, again, not just hits the brain, but also attacks the thyroid, attacks the adrenals, attacks other areas of the body, which leads to inflammation in those areas. We have a lot of moms with thyroiditis. We have a lot of kids with with PANS and PANDAS that have autoimmune thyroiditis. It's not, and nothing wrong with their thyroid. It's the inflammation there. So that inflammation in those areas then leads to the dysautonomia, and in addition, the immune intolerance in the gut leads to the vagal nerve being dysregulated also, and that leads to a lot of other symptoms. Think about all the things your vagal nerve is supposed to do. It's supposed to rest and digest and keep us calm, and when it's dysregulated, we're anxious or frantic or, stomach's upset or hyper, agitated, all of those things. So that's how it all goes hand in hand.
Are you suffering from Lyme disease or another complex chronic illness and aren't sure who to trust when it comes to herbal supplements? Hi, I'm Dr. Mariah Hinchy, founder of LymeCore Botanicals. As a naturopathic physician specializing in complex chronic infection-driven illnesses like Lyme disease, I needed herbal medicine I could truly trust. That's why I formulated LymeCore Botanicals, where our herbal tinctures are handcrafted in small batches right here in Connecticut. We use the whole herb, never isolates, to preserve the full spectrum of medicinal compounds. Every single step from sourcing to extraction is done with precision to ensure maximum purity, potency, and consistency. These are the same herbal formulas I use to heal myself and have used for years to help my patients and family members heal too. And now I'm making them available to practitioners and patients everywhere. LymeCore Botanicals, herbal medicine you can trust from a doctor who lives this work. Learn more at LymeCore Botanicals. That's LymeCore.com. Okay, so I want you to share with our listeners how you approach your treatment from a functional medicine lens. So, can you break down your framework for modulating inflammation, restoring immune balance, and supporting neurological healing?
Yeah. So first, I do a lot of detective work, figuring out what the underlying trigger or triggers may be. Again, by the time a child may be seeing me, it may be multiple triggers. But I look at the one that first started the symptoms and I want to treat that. And if it's chronic, especially, I want to think about treating it herbally because of the immune modulating properties of the herbs. Then I want to look at where is and how is the inflammation affecting this child, and often want to try to find anti-inflammatories or immune modulators that do more than one thing. So, for example, one of my favorites, turmeric, which is anti-anxiety, anti-inflammatory, anti-oxidant. I may want to use essential fatty acids. Again, those help cell-to-cell communication, may well help mitochondrial dysfunction, which is also a part of this, and definitely decrease inflammation and provide support for immune modulation. But it's really about trying to find in an individual kid those immune modulating factors, and the biggest of which is diet.
Right.
And so looking at their diets, it makes a difference if the child is 2 or 3 versus 12 or 13 as to how much you can implement the changes. But at the very least, trying to get more protein in, less carbs, getting rid of sweets, trying to make it as much of an anti-inflammatory diet as possible, removing things that a child may be sensitive to or craving. And then also with POTS, especially the very natural interventions are first plenty of fluids, at least an ounce per kilo per day, and often much more than that. And I'm not talking about soda or fruity
Right.
juices or milk. I'm talking about water, maybe flavored water, things like that. And then salt.
Right.
We do not give our kids enough salt. We have so much taken salt out of our diet because of partially erroneous information we were given about heart disease, etc. But children need iodized salt. They need the iodine for their thyroid. They need the salt for so many different pathways, but mainly to help these POTS symptoms. And then the third thing is actually exercise. And usually when they have these symptoms, they don't want to do that. And there's many reasons for that. Some of which is our EMF stimulation and screen time stimulation that is addictive in and of itself. And causes that horrible cascade, but that's a whole other subject. But
Mhm.
they're often lethargic or fatigued, don't want to move, or feel every time they do, they get worse. But the lack of exercise exacerbates the symptoms. So I often have them start with what are called isotonic or isometric exercises, or, like Kegels, like clenching and releasing their muscles, making it into a game, trying to figure out if they could do some yogic moves with mom, getting out and getting in the dirt, building a garden. If you live in the middle of New York City, getting a garden box and
Yeah.
doing it just in that, working with their hands, just getting things started. Swimming is a great way to exercise without expending a lot of energy, just getting them started at least. So all of those are really important. I'm sure I'm forgetting 20 others, but you'll remind me.
Well, I was gonna say just being outside,
Yeah,
breathing fresh air and being in the sunshine, right? Our sun vitamin is one of the absolute most helpful.
yeah, yeah, yeah.
So, how long does it generally, and I know it's different for every single patient, but how long does it typically take for you to recover someone that has PANS?
I think that it is very individualized in that it depends on how long they've been sick. If they've been sick for 7 years, it's not going to take me 7 days. It may take 7 months. It may take a couple of years. In my own son with Bartonella that I had missed for at least 7 years, it took 5 years to treat it.
Wow.
And some of that had to do with inconsistency, the shoemaker's kid has no shoes, but also he was off to boarding school and things like that. So there are factors that I know happen in every family's life, so that affects it. Also, it affects how much dysautonomia you have, because with the dysautonomia, it sometimes is harder for kids to take the herbals, botanicals, nutraceuticals because of nausea. So you have to go more slowly. And it also depends on die-off, Herxheimer reactions, how many triggers they are. But I think in general, we need to think about months,
Mhm.
not days,
Yeah.
and think about the marathon, putting one foot in front of the other, knowing there will be improvements, but there'll also be backslides, but that it's really not days or weeks, that it really is longer than that. And it's also just providing the foundation, because if you're not drinking, eating, playing well, pooping, sleeping, nothing's going to get better. So building the foundation of those things first often takes a couple of months,
Right.
before we're even going to start any of the other stuff. If you put a lot of nutraceuticals in a kid that's chronically constipated, all you're going to do is increase the die-off and Herx reactions. So you've got to build up their healthy lifestyle, build up their healthy guts before you could go in with the killing and the real healing.
Yeah, I couldn't agree more.
Yeah. So
So, what are the biggest misconceptions that you've encountered for either of these conditions from whether it be the medical system or the general public or other colleagues?
So one was what we just said, that you can't just go in and kill these germs and expect it to be all hunky dory.
Yeah,
You've got to do the whole picture. Two, that this is a waxing and waning disease. The child can be just fine 1 minute and a puddle on the floor or looking autistic the next. And we have to allow for that fluidity, both in ourselves as parents, but as teachers and practitioners and all of that. We have to understand the ups and downs. And then the third is that this can get better, but that it does take time, and it takes often a village that in addition to all the things I said, sometimes, the addition of physical therapy, craniosacral therapy, osteopathic manipulation, physical movement, occupational therapy, all of those may be really helpful for the child. And finally, do not blame the child. This is not their fault. They're not lazy. They're not stupid. They're not all the negative words you can think of. They are sick and they need our support, our understanding, and our help in getting better. So, as a parent, one of the things that I was taught very early on is even when I don't, to say, I get it, you know, and taking that breath and pausing because it allows the child the benefit of being able to feel a little bit more understood, as well as being able to just take that pause themselves and say, okay, somebody gets me. And I say
right.
it to the kids in my practice too, whether I do in that moment or not. They just need to be heard. And you've heard me say it many times. The best instrument in my office is a tissue box,
Yeah.
you know. So,
Yeah. And that's so true.
yeah.
You've helped so many people recover. What gives you the most hope right now when it comes to treating pans and pots?
I think there is more understanding. There is more recognition of the disease, even though it may not be done well. More people are hearing it. More people are aware of it. And there's research. As we know, the AAP, the American Academy of Pediatrics, came out in December of 2024 and said it exists. Yay!
Yeah.
But they said there's nothing we can do about it. And that made it even worse. But what was very clear is they hadn't looked at any of the studies since 2017. And since 2017 until that time, there were over 200 new studies. So, as long as we can fund the research, we will find more and more information, more and more connections about why this is happening and how we can better treat it. So, the research is there. There is information about this, and you just need to find the right sources. And there are tons of sources, not just you and I in our very busy practices, but, podcasts like this one,
Yeah.
conferences like the one you're doing in November at LymeBytes, and others like medmaps.org and the CME online course with Psychiatry Redefined that I'm doing, and all of those different things just to try to get the information in digestible forms to as many people that are willing to listen. And I just think there are more people willing to listen. We just have to keep trying.
Absolutely. It's encouraging that these diagnoses are being heard and are being, I guess, accepted. I'll use that lightly. But, it's funny. I had a parent the other day, come on to the call. It was a telemedicine, and they were like, "Hey, great news. We found out what's wrong. My child has POTS." And it's like, Wait, what? Like, yes, that's great that you feel better, that you're being acknowledged because now there's an accepted diagnosis, but it's like, to me, it's like that's describing a cluster of symptoms.
Yeah.
What are you going to do about it? Like, what's the pediatrician's plan to now treat this?
Right.
And it's like, well, there isn't a plan. They just have POTS, you know?
Mhm.
And it's like, well, okay, but what do you do? Like, you still have to understand what is causing it, because again, I feel like, and no offense to other pediatricians, but it's like, just because you can put a name on something doesn't mean that you're now going to be able to resolve this using conventional medicine. And so, to me, it's like, well, great, there's a name for a cluster of symptoms and a pathophysiological process going in the body. But now what do you do to resolve it? Because
Right.
this doesn't just mean now you have this for the rest of your life. And then on the flip side, with PANS, it's like, okay, well, you have this diagnosis, or god forbid, you've been diagnosed with just depression, anxiety, OCD, some other sort of neuropsychiatric disorder, or Tourette's, misdiagnosis. But it's like, what are you going to do about it, right? And so that's the piece where I feel like organizations like MAPS, which again is medmaps.org, or even ILADS, is starting to bring in a lot more focus on pediatric Lyme and pediatric vector-borne diseases. And then, because it's like, well, what do you do about it? Because these things are reversible.
Right.
They're healable, right? Like, you can recover that child and bring them back to having, a pretty typical life.
Right. Absolutely. Sid always called it name it, blame it, tame it medicine. We
Yeah,
name it something, we blame everything on it, and then we tame it with some, pharmaceutical or other intervention that only suppresses the symptoms.
right.
And the thing that happens with PANS is, oh, we have mycoplasma. Oh, we have COVID, but yet that's only one piece. Nobody's asking about the tick-borne diseases or the mold, et cetera, and those need to be asked about, thought about, not just where you and I live in, Lyme Central in Connecticut, but
Right.
also, throughout the world because it is ubiquitous. It's in every state in the United States and most countries in the world.
Yes.
And the other thing, about that is that it really is being a detective because so many of the tests that are done are either inaccurate, incomplete, downright wrong, or, they're not testing for, they may test well for Borrelia, but forget about Bartonella and Babesia. So we need to do all of that for our kids and really be the detectives that they need us to be.
Absolutely. So, what would you say to parents that are listening who maybe have never heard of these disorders before and are feeling overwhelmed or lost?
Yeah. So, first of all, uh, do listen to this podcast, as well as mine,
As I was going to say, as well
Demystifying.
as yours,
Yep.
especially if a parent thinks there's pandas going
Yep,
on.
and Dr. Hinchy is on there also. So, demystifying pandas. There's lots of good information on it. I have a book. Dr. Scott Antoine has an excellent book. Dr. Jill Krista has a couple of excellent books and a great one on mold called Breaking the Mold. There are multiple different conferences like medmaps.org, like ILADS, like LymeBytes, where practitioners go to get trained. So look at those sites for a like-minded practitioner, somebody that's speaking there or is a fellow in one of those organizations. And trust your gut as a parent. You know, if somebody doesn't feel like they're listening to you, maybe you need to find somebody new. If somebody isn't looking for all the different reasons that your child may not be getting better, maybe it's time to look for another practitioner. And there are tons of them out there. You just need to use those organizations to help you find them.
Yeah, absolutely. And if someone wants to work with you, how do they get a hold of you?
Well, as of last week, as of right now, I'm not taking new patients. I
Oh,
have an
no.
over year-long, maybe even 2-year waiting list. So you can go to drohara.com, and we would give you other practitioners in your area that may be helpful. We can also set up a mentoring consult that where I can help you and your practitioner, or you can join my membership, which is an annual thing with lots of monthly teachings, Q&As, videos, lectures, all kinds of stuff to learn and apply directly to your child. But I had to make that very difficult decision. It may change if I can get ahead of it, but given the busyness right now, I'm not taking new patients. So.
So, Dr. O'Hara, tell us how LymeBytes differs from other conferences in terms of quality or education or engagement. Why do you like speaking at LymeBytes so much?
Well, besides, it's led by one of my favorite people, Dr. Mariah Hinchy. It
Thank
is a
you.
wonderful conference that really helps to bring home the practical application of a lot of the researches out there. There are excellent speakers at ILADS, at many other conferences, but often we are given the research without the practical application of how to apply it in our practices, in our families, at home. And so you get very high quality researchers without, everybody duplicating each other, and very high quality practical application to come home with. And there are wonderful vendors, people to connect with, and just a very communal and welcoming format for everybody. So I'm excited to be there again
We're excited to have you again. Wouldn't be the same without you. You've been there since its inception.
and glad to do it and glad it's in Florida this year.
I know, me too. Can't wait. Thank you. Well, thank you so much for joining us today. Any last words of wisdom you'd like to share?
Um, as a parent, take care of yourself too. Putting on the oxygen mask is not just a trite phrase. It means take a deep breath, know you're doing the best you can today and every day. And if you mess up, apologize to yourself, to your child, to your spouse, to anybody you want to, and make the next step. And we all mess up, and it is a long road, but you can do it. Your child can get better, and we're here for you, one way or the other.
Thank you. Excellent advice. So, for all of you listening, if you would like to learn more and actually see Dr. O'Hara's in depth presentation on pots and pans from the LymeBytes Symposium, you can go to lymebytes.com and sign up for either the virtual or in person LymeBytes conference this November 14th and 15th in Pompano Beach, Fort Lauderdale, Florida. So, thank you so much for listening to Lyme Bites. We hope this brought you one step closer to true healing. If it helped you, share it with someone who needs to hear this too, because together we heal stronger. We'll see you next time.
If this episode gave you an answer, brought you new insight, or made you think differently, subscribe to the LymeBytes podcast and share with someone who's ready to take control of their healing journey. And if you can, please leave a review. It helps others to find the show. Thanks for listening, and we'll see you next time.